Welcome to this week's Tailboard on MRSA or methicillin-resistant Staphylococcus aureus. Staphylococcus aureus, often referred to as simply as staph, is a type of bacteria commonly carried on the skin or in the nose of healthy people. Sometimes staph can cause an infection. Staph bacteria are one of the most common causes of skin infections in the United States. Most of these skin infections are minor, such as pustules and boils, and can be treated without antibiotics. However, staph bacteria can also cause serious infections such as skin and soft tissue wounds, infections, bloodstream infections, and pneumonia. Methicillin-resistant Staphylococcus aureus, or MRSA, refers to the type of staph that are resistant to a type of antibiotic methicillin. MRSA is often resistant to other antibiotics as well. While 33% of the population is colonized with staph, meaning that bacteria are present but not causing an infection with staph, approximately 1% is colonized with MRSA. Signs and symptoms. Staph bacteria, including MRSA, can cause skin infections that may look like a pimple or boil and can be red, swollen, painful, or have pus or other drainage. More serious infections may cause pneumonia, bloodstream infections, or skin and soft tissue wound infections. Prevention. Practice good hygiene. Keep your hands clean by washing thoroughly with soap and water or using an alcohol-based hand sanitizer. Keep cuts and scrapes clean and covered with a bandage until healed. Avoid contact with other people's wounds or bandages. Avoid sharing personal items such as uniforms or personal protective equipment. Avoid using whirlpools and swimming pools if you have MRSA. Treatment. Many staph skin infections may be treated by draining the abscess or boil and may not require antibiotics. Drainage of skin boils or abscesses should only be done by a healthcare provider. Do not try to drain the infection yourself. However, some staph and MRSA infections are treated with antibiotics. If you are given an antibiotic, take all of the doses, even if your infection is getting better, unless your doctor tells you to stop taking it. Do not share antibiotics with other people or save unfinished antibiotics to use at another time. If after visiting your healthcare provider, the infection is not getting better after 48 hours, contact them again. If other people you know or live with get the same infection, tell them to go to their healthcare provider. MRSA skin infections can develop into more serious infections. Can I get MRSA from my work? MRSA is transmitted most frequently by direct skin-to-skin contact or contact with shared items or surfaces, for example, towels, used bandages, that have come into contact with someone else's infected site. Animals with MRSA can also transfer the infection to people who frequently handle them. However, people are usually the originating source of the infection in animals. MRSA skin infection can occur in any type of workplace. However, some workplace settings have factors that make it easier for MRSA to be transmitted. These factors, referred to as the 5 C's, are as follows: crowding, frequent skin-to-skin contact, compromised skin, cuts or abrasions, contaminated items and surfaces, and lack of cleanliness. Locations for the 5 C's are common include schools, dormitories, military barracks, athletic gyms, households, correctional facilities, daycare centers, and areas where animal handling is common, such as veterinarian clinics and livestock settings. If I have MRSA, can I go to work? Unless directed by a healthcare provider, workers with MRSA infections should not be routinely excluded from going to work. Exclusion from work should be reserved for those who with a wound drainage pus that cannot be properly covered and contained with a clean, dry bandage, and for those who cannot maintain good hygiene practices. Workers with an active infection should be excluded from activities where skin-to-skin contact with the affected skin area is likely to occur until their infections are healed. What can I do to prevent the spread of MRSA at work and at home? Cover your wound. Keep areas of the skin affected by MRSA covered. Keep wounds that are draining or have pus covered with clean, dry bandages. Follow your healthcare provider's instructions on proper care of the wound. Pus from an infected wound can contain staph and MRSA, so keeping the infection covered will help prevent the spread to others. Bandages or tape can be discarded with the regular trash. Clean your hands. You and your family and others in close contact should wash their hands frequently with soap and warm water or use an alcohol-based hand sanitizer, especially after changing the bandage or touching the infected wound. Do not share personal items. Avoid sharing personal items such as uniforms, personal protective equipment, clothing, towels, washcloths, or razors that may have come in contact with the infected wound or bandage. Talk with your doctor. Tell any healthcare providers who treat you that you have had or have staph or MRSA skin infection. That's it for this week's Tailboard, so get out there, have fun, and stay safe.